All right, so a couple of terms. Poison is a substance that produces a harmful effect. Toxicology is the science of poisons and their actions, detection and treatment. And then poisoning itself is the presence of signs or symptoms associated with exposure or contact with any substance. So, toxicology, the science of poisons. Science. Ooh, this one's got fun things. All right, we got 4 types of poisons. Of poisoning, you have your ingested, inhaled, absorbed, and injected. So ingested is the most common, that means you ate it. Inhaled, you breathe it in. Absorbed is absorbed through your skin, and injected is you shot it up like heroin. There are 3 forms of poison: solid, liquid, and gas. This is more important. This is more important than ID of toxin. So this is more important than identifying of the toxin. Is your 6 steps: your stabilization. You're observing for anaphylaxis, evaluation, your HPI, PE labs, reassess, document with times, prevent and limit absorption, such as your decon, flushing your eyes, ventilation, empty your stomach with charcoal or catheters, elimination, enhancement is for charcoal, hemodialysis, and hemoperfusion. So this is trying to flush it out and get out your body as fast as you can. There is certain antidotes that you can give for certain treatments. So given, if no, so only if you know what your patient took or what they inhaled, do you want to give it a real antidote, right? So this is give all patients glucose, thiamine, and naloxone to consider O2 therapy, and continue care, which is your monitoring, your PT education, so your patient education, psyche eval, and a follow-up. Poisoning should be suspected in all cases of sudden, severe, and unexpected illness. So you're going to ask for signs and symptoms. So you're pretty much going to do a medical evaluation of your patient, right? So you want to try and get down to the bottom as much as you can. If the patient's unconscious, you really can't get much out of them. But if you're able to talk to them and get what they did, if they remember ingesting anything, touching anything you shouldn't have been touching, you want to make sure you get all the information you can, because that's going to help lead you to your differential diagnosis and how to treat your patient. Okay, so you have your syndrome, your sources, and your signs and symptoms, right? So this is where you kind of gotta like think about, you know, looking at your patient and kind of know the difference, because there have been questions, I know 100% because I've studied this several times, about like your patient presents with beady eyes, decreased blood pressure, CNS, and respiratory depression. You know, what did they take? Narcotics, right? So it's just kind of just knowing like the signs and symptoms of your patient to help you kind of get to that point. All right, for any type of general treatment for your 4 types, if they're ingested, you gotta make it throw up, right? Gotta get out of there somehow. If they, you know, did inhalation, you're gonna give supply O2 ventilation. Absorb, you're gonna try and flush the skin. If it's injected, you're gonna try and get that antidote medication of whatever they took. So ingested poisons, so your local actions are acidic or corrosive, and basic and caustic. So non-local actions are 2 types. So the non-toxic substance and your potentially toxic. So your non-toxic is your latex paint, silica, spider plant, dirt. No decon of stomach required, so you're not having to pump somebody's stomach. If it's potentially toxic, so like your fish, heavy metals, medications, pesticides, and personal care products, that's when you kind of start looking at more invasive and intrusive actions to help flush that out, right? So your non-corrosives, nausea, vomiting, convulsions, abdominal pain. They have a strange taste in their mouth, their lips, mouth, and tongue, or feel kind of funky, a little different. And then here's your different type of non-corrosive: your arsenic, your copper, your iodine, your mercury, your phosphorus, silver nitrate, and zinc. So this is pretty much how you're going to, this is a different type of sources that you can get these different irritants from. And then you're going to go through your basic first aid, your ABCs or CVA, We're gonna dilute, empty the stomach, collect their vomit, so we don't get to just like throw it away. We gotta collect it and then send it.
For testing.
Right. So you're gonna smooth the stomach with milk of mag or milk transport to definitive care. Mom is not like, oh mom, take care of me, milk of mag. Some more about some corrosives. You have your acids and your alkalis. So one does more damage to this acid of the stomach, while the other one does more soft tissue, destroys tissue in the mouth, throat, and esophagus. And then your signs and symptoms: actual burns to the lips, mouth, throat, and stomach. There's a smell, difficulty swallowing, stridor, tender abdominal pain, and may perforate esophagus or stomach. So they're gonna start having holes in their throat. More goodie tables. So your acids, your alkalis, and your phenols. This is where you can get the contact with these different type of acids. This is kind of why it's really important that we have that SDS binder with us when in our workspaces on our ships. That way we know, like, hey, this is how we can treat this, or this is what we can do. So they're not there just to be like annoying, and then people ask you like, hey, where's your SDS binder? We should know where it's located. Like, that actually has some good information in it. Do not induce vomiting. Never attempt to treat an acid or base ingestion by administering a neutralizing solution by mouth. Give water only unless directed by a poison control center or medical officer. You know, there's a reason why this is written, right? Because somebody somewhere did something. And here we go. Big, bold red letters. All right, first aid and treatment. It's great. Food poisoning, usually caused by ingestion of a plant or animal that is either had a parasite or was not cooked completely. It occurs within 8 hours of ingestion. Nausea, vomiting, diarrhea, muscle aches, low-grade fever. You're going to get some supportive IV for dehydration. If patient's like severely nauseous, you can give them some for that. But the best way to treat this is let it flush itself out. As long as your patient's staying hydrated, that's pretty much all you're going to do for them. It's symptomatic care at that point. Inhalation poisoning. So these are all things that you're going to breathe in and can cause issues. Nail polish remover, fires, shoe polish, dry cleaning, paint. These are all the different things that can cause some type of poisoning. To remove the victim, keep patient calm, give them some O2, and you're on transport. So absorbed poisons are cause tissue irritation or destruction by contact with the skin, eyes, and lining of the nose, mouth, or throat. Substances include acid, alkalis, phenols, and some chemical warfare agents. Treatment varies with each substance, so you want to look at your sea burning on chapter 23. Alright, so if someone that gets stung by a bee, wasp, or fire ant, they're going to have local swelling, pain, pruritus, and erythema to that site. You're going to monitor the vitals, remove jewelry, remove stinger if you can. You're going to use ice or corticosteroids. Severe allergic reaction, you're going to give epi, so 1 per 1,000, and then you want to get them out of the situation they're in. I'm not sure if they still. I know at one point in time there was a question I talked about, like, how would you remove a stinger, and it's use like a credit card to kind of scrape at the skin to help get it out.
Mm-hmm.
Scorpions, local swelling, pain, skin discoloration, and all this symptoms last less than 24 hours. First aid, you're going to do ice evaluate. You're going to use some calcium gluconate for muscle cramps, benzos for convulsions, and antivenom for the stings. Do not give your patient morphine. Spider bites are gross. Your black widow and your brown recluse. Brown recluse are huge if you've never seen one, and they're super gross.
Yeah, violin shape on the end of their thorax.
It's important to know that for your black widow, for treatment, you're going to do ice, hospitalization, and antivenom with severe symptoms. And then for your brown recluse, you're going to need wound debridement, peroxide, and aluminum acetate soaks, bacitration, sterile dressing. So the brown recluse bite can cause necrosis of the spot. So what happens is that when the spider bites you, the venom seeps down into the wound. It can cause necrosis of that area, and if it's untreated, it can spread. It's super gross.
Usually it's worse after 4 hours.
Yes.
And after 24 hours, you're done for.
Yeah. Snake bites. Your 5 venomous families. Don't look for me around snakes. If you get bit by a snake, I'm probably gonna say you shouldn't have done that. Yep. We going to the zoo. Don't look for me in the reptile display. I won't be there. This time about different ways to identify your really poisonous snakes, your pit vipers, your coral snakes. And then some first aid. You're going to identify the snake if you can. You're going to generally wash your wound, use extractor if available. Position of comfort, remove jewelry, IV, monitor. Do not move. Do not give anything to eat or drink. Binge, split, and hospitalization for at least 24 hours. Usually if you're able to identify what snake it was, they're able to give some type of antidote for their venom. If not, I'm sure they can figure out what to do. Do not try and suck venom out by mouth. I'm just saying, if Steve Irwin told me back in the 90s that I was allowed to do this, I was going to do it. I'm just saying.
It's a very ancient way of trying to do it.
Listen.
Especially if you don't have the resources of a hospital or anything like that nearby. That's the old way of freaking doing it. It's dumb.
Right. So, although we love fish, I think fish are super pretty. I love swimming with fish. You still gotta be cautious, the poisonous ones, your puffer, your triggerfish, your parrotfish, porcupine fish, surgeonfish, goatfish. I've never heard of a goatfish, now I wanna go find one. So these fish are poisonous. It's important to remember that they're dead fish. Spines still remain toxic. If somebody gets stung or bit or encounters one of these fish in the water, remove the victim, keep them calm. Rinse with cold salt sterile water, submerge for 30 to 90 minutes as hot as can be tolerated, but not more than 114 degrees Fahrenheit. If on face, use hot compress. Jellyfish. Somebody gets stung by a jellyfish. Can cause minor irritation to death depending on how severe and where you get stung. Use vinegar or a 3 to 10% solution of acetic acid, an aqueous solution of 20% aluminum sulfate and 11% surfactant is moderately effective, but vinegar works best. If they have a tentacle still attached to them, use a towel or clothing to pull it off so that way you don't sting yourself. Do not use alcohol, picric acid, human urine. Do not pee on them. Do not pee. What's that say? Do not use human urine. So what we not do? Pee on our people. Drug abuse. Drug abuse is the use of drugs for purpose or in quantities for which they were not intended. Abuse may be swallowed, inhaled, snorted, injected, or even absorbed through the skin, rectum, or vagina. When abused, therapeutic drugs become a source of poison to the body. Drug abuse can lead to serious illness, dependency, and death. So, this is important, actually, for many reasons, not only for your exam, but also just know in real life. There are stimulants, depressants, opium and opium alkaloids, mind-altering drugs, and inhalants, right? So with each one of these, there's different signs and symptoms that you can tell with your patient because of what's happening. Do the pupils dilate? Are they constricted? Does your patient, are they out here acting crazy? Like out here not knowing what to do with themselves? So some of your stimulants that we see all the time that are very common is going to be like your cocaine, your methamphetamine, so your speed, crack, meth, crystal, diet pills, Ritalin and Concerta. Adderall falls into these lists of stimulants. Adderall can be abused and people do stupid things with it. You also have your depressants, so these are all your downers. These are things that's going to, like, instead of making you feel good about yourself, or make you feel worse about yourself. Why people take them, I don't know. So your phenobarbitals, your barbiturates, some opiums, any type of pain meds you get for surgeries or whatnot. So your codeine, your fentanyls. You can also do heroin, methadone, morphine, Tylenol with codeine. So your Tylenols 1, 2, 3, or 4. All those are going to be your opiums. Mind altering drugs, so your hallucinogens, your LSD, your PCP, your then you also have like cannabis, hash, marijuana, THC, and then you also have your inhalants, which is like your cleaning fluids, furniture polish, gasoline, glue, hairspray, paint thinner, typewriting correction fluids. Okay. I'm still stuck in this typewriter correcting fluids. I'll have to look that one up because that's interesting. I've never heard of typewriter correcting fluids. All right, opioids. How do they affect your central nervous system? You can go to a coma, respiratory depression, lethargy, restlessness, dizziness, and scarring. Somebody's going through an opioid withdrawal is the most violent thing you've ever seen in your entire life. They are agitated, they're restless, possibly hallucinating. They appear a few hours after last dose and peak 72 hours after last dose. So when somebody is coming down from opioids and they're going through withdrawal, so let's say they're in a treatment facility or they're one of your sailors and you're confining them to a space like we're going to get you taken care of. If they are highly addicted to the opioid, a few hours after they come down from their high, they're going to start getting agitated immediately. They're going to get agitated, they're going to get restless, they're going to be able to sit down. That 3-day period after, where their body is officially starting to flush it out, it's going to be the extreme, the worst. They're going to be very aggressive, they're going to start hollering, screaming, carrying on, they're going to start seeing things, they're going to get the night sweats, they're going to start shaking, they're going to get very, very rough for a while until we can get them taken care of. We want to know about alcohol. Barbiturates, so your benzodiazepines have largely replaced barbiturates or downers as sedatives, hypnotics, so sleeping pills, and then your anti-anxiety agents. Prolonged use of barbiturates can lead to a state of physical and psychological dependency. Withdrawal is life-threatening. So these are people that take these, that live for sleeping pills, that live for these anti-anxiety meds because that's how they feel better about themselves. But once they get to a dose where they're taking too much too often, that's when we start having issues with their withdrawals, because then they start not only getting those feelings that they don't want to have anymore, which could lead to suicides, but it can also cause them to just like their body just to shut down, and then because they don't know how to handle themselves. So your non-barbiturate sedatives. So these are your hypnotic, is like a sleeping pill, have actions very similar to barbiturates. However, they have a higher margin of safety. Others, an addiction requires larger doses, and addiction requires a longer time period to occur. So your uppers. These are people that take the good stuff to feel good, right? They're like, I love feeling high, so I'm going to take all these uppers, these things that make me feel good about myself. Those that directly affect your central nervous system by increasing mental alertness and combating drowsiness and fatigue. One group of stimulants called amphetamines is legitimately used in the treatment of conditions such as mild depression, obesity, and narcolepsy. So your amphetamines is going to be like your Adderall. You're welcome. Sweating, increased temperature, tachycardia, and hypertension are all, related to taking these uppers and these stimulants. got me over here feeling like a whole druggie now. Jesus. Hallucinogens. This is, you know, back in the 70s, LSD baby, right? PCP. They appear in different forms such as crystals, powders, and liquids. You can notice dilated pupils, flushed face, increased heart rate, and a chill feeling like they're cold once, you know. Ooh. Talking about that cannabis, the Mary J, widely abused and may be classified as a mild hallucinogen. Just because states legalize it does not mean we can do it. It's coming from your command APA. Decreased pill, so when people are smoking marijuana, decreased pupil size, injected conjunctivitis to that red eye, tachycardia for about 2 hours, slightly increases systolic blood pressure in low dose and can lower blood pressure in high doses and cause munchies, so they're always hungry and dry mouth. So although cannabis is, no, we're not supposed to use it, however, it does have medicinal properties to it. It can help treat acute glaucoma, asthma, nausea and vomiting from chronic illnesses. I know they also have used medical marijuana in treatment for like cancer patients. And it has also been used to help people with anxiety and depression who don't want to go on these, you know, stimulants and these highly addictive, you know, meds. They'd rather smoke marijuana and feel happy versus taking pills and feeling numb. So inhalants are any of the vapors that can be caused by extreme dangerous when inhaled inadvertently or by design. Inhaling any type of drug, intoxicated person, you know, figure out what's going on. If they lose consciousness, put them in the recovery position, shots on their side, arm up, supporting their head. So if they decide to throw up, they don't choke on their own vomit. You give them dextrose, Narcan, and thiamine to adults. Cardiac monitoring observed, decon stomach is ordered, prevent patient from harming themselves, gather paraphernalia, transport patient, and then turn to recovery facility. Any questions? Cool. So in the end, I would say out of this whole thing, this is important to know. And then I would also want you to know, oh, there's one I like. Look at, in this, this chapter of the Corman Manual with each of these specific meds that highlight, I think, in the highlighted portions of certain ones, it talks about like signs and symptoms of the patient. So what they're looking at is like this sweating, increased temperature, tachycardia, hypertension, and then this one's dilated pupils, flushed face. They ask questions like this. So it's important to know, like when you're looking at your patient, like, oh, your patient has dilated pupils, flushed face, increased heart rate. You know, what type of drug did they take? You know, list barbiturates, methamphetamines, hallucinogens, and then something crazy. So that's where you're kind of like, oh, dilated pupils, flushed face, increased heart rate, they took in a hallucinogen. So those are questions to look into specifically for this poisons and drugs.
Gotcha.
Alrighty.
So you already did the pocket guide to malaria?
No, that'll be our last one for today.
Okay, gotcha. Health source support operations, medical surveillance and reporting.
So I know Senior went over the CBRNE handbook on Wednesday, so we're just going to fly through this one real quick. It's just talking about like the aseptics of CBRNE and chemical, biological, and radiological warfare. This is chapter 23 of your Corman Manual. I'm not going to beat a dead horse. I hate that to death, and it does not make any sense to me of why we would just keep repeating ourselves. Like I said, I don't waste time. So, how do we detect any type of chemical, biological, or radiological warfare? Well, we have these awesome different type of detection kits. So we have your M9, your M8, and your Mach 256 Alpha 1, right? So these chemical agent detector kits each have different ways of detecting different warfare. So your M9 is your most common detected liquid agents. It detects nerve agent, blister agent by turning a pink and red, reddish brown, or purple color. So this is where you want to, and self-adhesive. So what you do is you peel it off, you take it, you stick it to a wall, and you walk away, and then you watch and wait for it to detect if there's something going on. Now, if it turns this pink, red, reddish brown, or purple color, you know that you got yourself a nerve or blister agent. Okay?
Oh, I know the greenish brownish too.
Yeah. So your M8 chemical detector, gold yellow for G-class nerve agent, olive or Verdana green for VX, and then your red or purple for blister agents. And then our last one here, the Mach 256 Alpha 1 detects nerve gas, mustard gas, and cyanide, and detects vapor into about 15 minutes. These are good to know. I wish my thing worked on the TVs, but they don't.
Mm-hmm.
All right, chemical agents and nerve agents. All right, so typically odorless, almost colorless, liquid or vapors, varying greatly in viscosity and volatility. So how are we going to treat these? We're going to do atropine, 2.1 milligrams. You're also going to use the 2PM chloride, which is a 600 milligrams, and a convulsive antidote nerve agent, or a cana, or a diazepam, 10 milligrams. All right, so here's our different blister agents. I hate these with a passion because I can never remember these because I have no way to remember them. Why does H equal mustard? I don't understand. It doesn't make sense to me. I don't know. So whoever made these, we need to reevaluate our lives, right? So your common blister agents are going to be your mustard, right? Your mustard gases, and then the Lewisite. The most common one we hear about is our mustard. So if you see H, HD, HN, that's going to be indicating some type of mustard agent, right? Some signs and symptoms: gritting eyes, spastic blinking, and photophobia. Blistering occurs within 12 to 48 hours. Primary cause of death is edema or pulmonary obstruction. It's colorless, oily and pale yellow, garlic, mustard, horseradish, or fishy and smell, and there's no specific antidotal treatment. So your common blood agents are going to be your cyanide, your hydrogen cyanide, and your cyanogen chloride. So for blood agents, ACCK, both have C's, and cyanide is a blood agent. So this is a cellular suffocation. Patients will have dizziness, nausea, eye irritation, apnea, and cardiac arrest. And some characteristics for a blood agent: it has this, it smells like bitter almonds. There's like an almond smell to it. You're going to apply a gas mask, and you can treat with 2 to 8 nitrate ampules, or 300 to 600 milligrams of IV sodium nitrate, and 12.5 grams of sodium thiosulfate. But see, then my C's don't work for this because there's C's in pulmonary. Like, it doesn't make sense. Okay. All right. Anyway, I just don't get it, right? All right. Pulmonary agents. So this is your phosgene and chlorine. This can cause irritation of the eyes, nose, and airway, coughing, dyspnea, hoarseness, sneezing, wheezing, a feeling of tightness in the chest, and symptoms. No symptoms after 2 to 6 hours. No antidote for pulmonary agents. It does damage the lung membrane. It's colorless, and it kind of has that fresh mown hay or grass smell to it. So every time I smell like the grass out here, this is the first thing I think, oh my god, we're about to die. Serious. Got me walking through the cat lab, I'm like, man, it smells like fresh mowed lawn out here. I'm like, oh, this is it. That or I'm having a seizure. One of the two, I'm not really sure. I'm stroking out or going to die. Not really sure which one. All right, types of biological agents. So these are your bacteria, your viruses, and your toxins. So what falls under your bacteria agents? You have your anthrax, to the room. And your plague, viruses can be your smallpox and hemorrhagic fevers, and toxins, your ricin, botulism, and any other toxins. So this is kind of where, with these ones, you kind of think almost like scientifically, but also medically at the same time, right? So if we was thinking about like plague, the plague is spread by bacteria, right? So it's gonna be part of our bacteria agents. Smallpox is a virus in nature, so we can think as a virus biological agent. Toxins are non-man-made, non-volatile, harmful substances created by plants, animals, bacteria. It's important to note they asked this question. Anthrax. So this is a gram-positive, so we talked about gram-positive and gram-negative yesterday. Encapsulated spore-forming non-motile rod. So spores survive years or decades. The incubation period is 1 to 7 days or up to 60 days. Infectious routes are cutaneous, which is 20 days, pulmonary, 10 days, or gastrointestinal, which can last up 2 to 5 days. So cutaneous is through the skin, so it's absorbed. So you can be absorbed, you can breathe it in, or you can eat it. And using a belly, using that system. Treatment, Cipro. You get some Cipro. Sorry, Cipro. Oop. Prophylaxis vaccines, a series of 6.5 milliliter subcutaneous doses at 0, 2, and 4 weeks, and then 6, 12, and 18 months, followed by an annual booster. So they don't do these no more. We really don't be giving anthrax vaccines anymore unless it's absolutely 100% indicated for the area you're going to. Plague. There was actually a plague outbreak. Where was it? I think some of the United States actually ended up having the plague. I forget when. This was very recently though. All right, so unlike anthrax, which is gram-positive, your plague is a gram-negative, raw, non-motile, and non-sporulating. It's a pneumonic. So there's a pneumonic plague, which develops pneumonia, and the bubonic plague, which is progressed to others. There's the septicemic plague, which causes weakness, circulatory collapse, septic shock, organ failure, usually follows bubonic plague. So I get your bubonic plague, and then you go into septic plague, and then you die. Just kidding. You don't have to die. Laboratory testing can confirm the plague. Small gram-negative and/or bipolar staining. Coccobacilli can be seen on a smear. So this time going back to that lab portion, we're talking about the different types of shapes of bacteria. So your bacilli, things of that name. How do we want to treat the plague? We're going to give streptomycin or gentamicin over this course of time frame with these amounts of dose. Prophylaxis is doxy 100 milligrams, PO daily, twice a day. And it usually takes about 3 to 5 days with a range of 1 to 14 days for this to make an appearance. It's crazy to think that the plague took out like half of Europe.
Mm-hmm.
It's wild, right? See, that's why we don't mix sewer water with drinking water and then let rats into our homes. So botulinum. So this is your encapsulated anaerobic gram-positive spore-forming rod-shaped bacterium. Neuroparalytic, blocking release of acetylcholine release. It takes 12 to 36 hours or up to several days for it to show signs. Cranial palsies, so double vision, blurred vision, and slurred speech are your signs and symptoms. Man, maybe I got botulism. Treatment is this trivalent antitoxin or heptavalent antitoxin, depending on the type of infection you have. Prophylaxis and preventive pentavalent, which covers those 5 different kinds. Toxoid is distributed by the CDC to amuse laboratory workers and protect troops against attack. The toxins is readily inactivated by sunlight, so 1 to 3 hours or anything 80 degrees Celsius for 30 minutes or 100 degrees Celsius for several minutes, and surfaces may be decontaminated with bleach. So what this is saying is if the toxin itself reaches any type of heat or sunlight, it dies. All right, so our radiation types, alpha, beta, gamma. Alpha is heavy, very short range particle that are not able to penetrate clothing or skin. So your alpha, you can sit there like this and be like, oh, you ain't finna get me. Radiation, Radiation is light, short-range particle, and it's actually an injected electron. This form of radiation may travel several feet in the air and is mildly penetrated more than alpha particles. And then your gamma rays are electromagnetic waves, highly penetrating electromagnetic radiation that is able to travel many feet in air and many inches through human tissues. So if you want to become the Hulk, anybody start watching She-Hulk yet? I did. It's good. It's gonna be a good one. Feel my soul. Radiation is measured in REMS and is used to drive a quantity of exposed dose, and sievert is exposed dose equivalent. So when we start talking about like REMS and whatnot, it's where we start talking about like our radiation safety also. That's how we measure radiation, right? Look at that. Any questions?